Welcome to AI News Digest 2026-0625. Today's 8 stories. Story 1, The Hitchhiker's Guide to Agentic AI, From Foundations to Systems. Story 2, Large language models demonstrably withhold, soften, or suppress true information. Story 3, TRUSTMEM, Learning Trustworthy Memory Consolidation for LLM Agents with Long-Term Memory. Story 4, Heuresis, Search Strategies for Autonomous AI Research Agents Across Quality, Diversity, and Novelty. Story 5, Large Language Models versus Small Language Models. Story 6, Synthetic Data for Multimodal Large Language Models. Story 7, The Clinician's Veto, Navigating Trust, Liability, and Uncertainty in Autonomous AI Prescribing. Story 8, To Isolate or to Score, Model Adaptive Assessment for Cost-Efficient Multi-Agent RAG. Story 1, The Hitchhiker's Guide to Agentic AI, From Foundations to Systems. Here is a research paper that tackles a very real and pressing problem for anyone building AI systems in production. How do you make document retrieval and assessment work efficiently when you can only afford smaller models? The paper, titled To Isolate or to Score, was submitted to arXiv in late June 2026 by researchers Youngseob Lee, Changjun Park, and Heuresis Lim. It zeroes in on multi-agent retrieval augmented generation, or RAG systems, which are pipelines where AI models retrieve relevant documents and then reason over them to answer questions. The multi-agent assessment step, where models evaluate which documents are most useful, is expensive, and that cost pushes practitioners towards smaller 7 to 9 billion parameter models. But here is the problem. Nobody really understood how these smaller models benefit from assessment in the first place. That is exactly what this study set out to answer. What the researchers found is genuinely surprising. There is a sharp divide between weaker and stronger models in how they gain from assessment. For weaker models, the key driver of performance is not scoring document quality at all. It is simply separating documents so the model does not get confused by reading multiple documents at once. And here is the striking part. Doing that isolation without any scoring whatsoever matches the performance of a full, expensive multi-agent assessment pipeline. The gains from this simple trick are enormous, up to 50 percentage points on question-answering benchmarks. That means a huge chunk of the computational cost in these pipelines is being spent on something that does not even help for weaker models. For stronger models, the story is different. Scoring quality does matter, and the team introduces a technique called reasoning score coupling, a lightweight probe that detects whether a model's scoring is reliable. They bring these two strategies together in a system called MADARA, which diagnoses each model and routes it to the right assessment approach. The most compelling validation is that MADARA's diagnostic thresholds, derived from just one pilot model, generalize without any retraining to 4 completely different model families. That is a strong signal that this framework is capturing something fundamental about how models work, not just overfitting to a specific case. For teams running RAG in production, the takeaway is clear. Profile your model first, and you may be able to dramatically cut costs without losing a single point of accuracy. Story 2. Large language models demonstrably withhold, soften, or suppress true information. One of the quieter but genuinely important challenges in building advanced AI systems is a data problem, specifically, a multimodal data problem. Teaching an AI system to reason across images, text, audio, and video simultaneously requires enormous quantities of high-quality paired training examples. Images with accurate captions, videos with precise descriptions, medical scans with expert annotations. And that kind of data is extraordinarily expensive and slow to produce at scale. A new preprint published in June 2026 on Preprints.org tackles this problem head-on. The paper surveys the emerging field of synthetic multimodal data generation, the idea that AI systems themselves can be used to create the training data needed to build better AI systems. The authors characterize high-quality multimodal supervision as the central bottleneck limiting the development of more capable multimodal large language models, and they argue that synthetic data generation is the most scalable path forward. The timing is significant. Multimodal AI systems have grown explosively throughout 2025 and 2026. Models like GPT-4V, Google Gemini, and others can now process images, understand diagrams, interpret charts, and engage in visual reasoning. But these capabilities are only as good as the data used to train them. By surveying synthetic generation approaches across vision, language, and other modalities in a unified framework, this paper provides a much-needed map of the landscape for researchers and engineers. The implications are substantial. If synthetic multimodal data can reliably match the quality of human-annotated data, it could democratize the development of advanced AI systems, allowing organizations without massive proprietary datasets to compete with the largest tech companies. However, the risks are real. Researchers have documented a phenomenon called model collapse, where models trained on synthetic data gradually diverge from real-world distributions, producing outputs that are increasingly narrow or distorted. For high-stakes applications like medical imaging or autonomous driving, the quality bar for synthetic training data must be exceptionally high. This preprint is an important early synthesis of the field, though its status as an unreviewed preprint means its conclusions warrant careful scrutiny before being applied in practice. Story 3, TRUSTMEM. Learning Trustworthy Memory Consolidation for LLM Agents with Long-Term Memory. In June 2026, a team of 7 researchers submitted a paper to arXiv that addresses one of the most consequential intersections of artificial intelligence and public health: autonomous AI prescribing. This is not a theoretical concern. 2 real pieces of U.S. legislation, House Bill H.R. 238 and a prescription renewal pilot in Utah, have already granted AI systems the legal authority to prescribe medications without requiring a human clinician to approve each decision. The question this paper asks is, are these systems architecturally safe enough to be trusted with that authority? The answer, based on both a careful technical argument and a survey of 136 U.S. prescribing clinicians, is a qualified no, at least under current regulatory requirements. The researchers identify 3 features they call minimum architectural requirements for safe autonomous prescribing. First, systems must provide calibrated per-prediction confidence scores that can trigger automatic escalation to a human clinician when confidence falls below a threshold. Second, systems must communicate the difference between 2 fundamentally different types of uncertainty: epistemic uncertainty, which means the model simply doesn't know something because it lacks relevant training data, and aleatoric uncertainty, which means the clinical situation itself is genuinely ambiguous. Third, systems must provide inferential transparency, a clear explanation of why a recommendation was made at the moment of decision, so that liability can be meaningfully allocated. The clinician survey results are striking. Prescribers said they would not permit autonomous AI prescribing at all without a confidence-based escalation mechanism. When facing genuine clinical ambiguity, they wanted the AI to present competing options. But when facing model ignorance, they wanted the AI to abstain entirely rather than guess. And they were only willing to accept personal liability for an AI-assisted prescribing decision if they could genuinely understand and evaluate the system's reasoning. The broader implication is sobering. Current regulatory frameworks require only aggregate performance metrics, how accurate is the model on average, and mandate none of the 3 safety features the researchers identify as essential. As state-level pilots expand and federal legislation advances, this gap between regulatory standards and technical safety requirements represents a genuine patient safety risk. The researchers conclude that a properly designed system would function less like an autonomous prescriber and more like a heavily supervised decision support tool, which raises the question of whether the legislative framing of these pilots as autonomous AI prescribing is itself misleading. Story 4, Heuresis. Search strategies for autonomous AI research agents across quality, diversity, and novelty. Heuresis introduces a framework enabling LLM-based agents to autonomously conduct scientific research by exploring performant, diverse, and novel ideas beyond just code generation. The framework abstracts the research pipeline into general composable primitives for open-ended scientific exploration. This is a significant step toward autonomous AI-driven research acceleration. Story 7. Large language models versus small language models. A technical comparison of large and small language models framed as different engineering responses to different constraints, with particular focus on deployment environments. The piece examines where each model type runs and what trade-offs govern the choice between them. Practical guidance for engineers choosing between LLMs and SLMs for real-world applications. Story 8. Synthetic data for multimodal large language models. This preprint addresses the central bottleneck of high-quality multimodal supervision for multimodal LLMs, MLLMs, proposing synthetic multimodal data as a scalable solution. The paper surveys and analyzes synthetic data generation approaches for training MLLMs across vision, language, and other modalities. Highly relevant given the rapid growth of multimodal AI systems in 2025-2026. Story 9. The Clinician's Veto. Navigating Trust, Liability, and Uncertainty in Autonomous AI Prescribing. This paper examines the transition of AI systems from advisory to autonomous roles in medication prescribing, analyzing recent U.S. legislation, H.R. 238, and Utah's prescription renewal pilot. It critiques current regulatory guidelines for relying on aggregate model performance metrics without requiring per-prediction confidence thresholds. The work highlights critical safety gaps in high-stakes autonomous AI deployment. Story 10. To isolate or to score. Model adaptive assessment for cost-efficient multi-agent RAG. This paper conducts a controlled study of training-free interventions for multi-agent RAG using smaller 7B9B models, revealing a sharp dichotomy in how models benefit from document assessment strategies. The findings provide practical guidance for deploying cost-efficient RAG pipelines without retraining, particularly relevant for practitioners building production RAG systems on limited compute budgets.